Number 3. MOH implements AI-assisted lung screenings in select health clinics.
Yeah, so these screenings are only available for targeted groups in 7 health clinics nationwide. According to the Health Minister, Dr. Zulkifli Ahmad, they are trying to increase early detection of lung-related diseases among Malaysians. This is one of the key efforts of the Malaysia Lung Health Initiative, which launched this year. It aims to strengthen prevention, screening and treatment for lung diseases. And after all, lung cancer is the 3rd most common cancer in our country.
So let's look at how these screenings work. The initiative is still in its pilot phase, but it targets high-risk groups. Think smokers, chemical industry workers, people exposed to toxic substances, people who inhale secondhand smoke. Compared to conventional X-rays, these scans will be more effective because they can identify small swellings in the lungs that might be invisible to the human eye. And then if there are any concerns flagged, the patient will then be sent to nearby hospitals for follow-up treatments and CT scans.
Now, surprisingly, the cost to implement this system is fairly low. At just 10,000 ringgit per clinic, the Health Minister believes that they will have a quick return on investment. And it looks like it's already paying off. According to Dr. Anand Sanchita Nandan, founding president of the Lung Cancer Network Malaysia, LCNM, the AI-enabled X-rays are already improving diagnostic accuracy and reducing the workload of hospital radiologists. He believes this technology will help broaden access to proper care, as it is fairly easy and affordable to implement, especially in rural areas.
So for more on this, we reached out to Dr. Anand himself, clinical professor of cardiothoracic surgery and founding president of the LCNM, for his thoughts. He first explained how the AI lung screenings work and how adopting the technology nationwide will be beneficial.
In the context of lung cancer, for example, the idea is to pick up the disease at a preclinical or an asymptomatic phase before a person is a patient, before they develop symptoms. We know early stage lung cancer is more amenable to treatments with a curative intent. So the technology, artificial intelligence technology, a type of machine learning, will utilize deep learning neural networks, and it's about pattern recognition to be able to identify from a chest X-ray or even a CT scan certain patterns which may indicate underlying pathology or abnormalities that can be easily flagged up and that may be actually missed by a human radiologist or doctor. I think this has immense potential because this technology is scalable. A lot of the AI software is cloud-based. It can be deployed remotely, and it can even be deployed in remote locations. And certainly you don't need a highly trained radiologist on site. So it is scalable technology. This will really broaden access, and I would say democratize access to screening, and is a real potential game changer.
He then shares how these screenings encourage early detection of lung disease, especially among non-smokers.
So I think if it is used wisely, these AI-enabled chest X-rays have immense potential. They can help to funnel the right patients or individuals to go on to have a CT scan. So for example, with regards to screening for lung cancer, most of the criteria focuses on smokers, people with a tobacco history. And, one of the phenomenons we have observed in recent years is the rising incidence of lung cancer in the non-smoker or never smoker. So we really need to address this unmet need to diagnose lung cancer earlier in the non-smoker or never smoker, a majority of whom are women. And I see AI-enabled chest X-rays having immense potential to broaden the criteria for screening for lung cancer. We have a high disease burden in this country, a preponderance of late-stage presentation, late-stage diagnosis. We know that early-stage lung cancer is potentially curable. It is also more cost-effective to treat. Therefore, if we can pick up the disease earlier through screening, targeted screenings, and broaden the access to screening, including targeting, for example, not traditionally just smokers, but even the high-risk non-smoker, those with a significant family history, then I think we really can help shift the curve and create what we call a stage shift or stage migration and increase the proportion of Malaysians with lung cancer who are detected at an earlier stage. A combination of targeted screenings of at-risk or high-risk groups, together in tandem with preventative strategies, including efforts to mitigate air pollution, exposure to secondhand smoke, and of course effective tobacco control. They go hand in hand if we are to improve, lung health in our country.
That was Dr. Anand Sachitanandan, founding president of Lung Cancer Network Malaysia. If you have thoughts on the story, call 7733 2900, send a voice note or WhatsApp 018 789 8899 and tweet us at BFM Radio.